to start a.
Go ahead.
We're trying to get organized and start maybe a regular Tuesday night meeting for the Angstrom team. There's quite a few, and so it's kind of nice to get a little bit more solid info and Q&A from Dr. Stacy, who's a well, doctor, says it all, right? He kind of knows what she's talking about way more than the rest of us do. And we have focused more on, in terms of testimonials, on those that have some sort of a medical device or medical professional actually tracking, some response in the body, as opposed to just a, hey, I feel this or I feel that, which is great, and wonderful. It goes to quality of life. But, when we see, doctors tell people to stop their chemo and just wear the patch instead because their numbers return to normal, or they're walking and they couldn't, it's pretty amazing. So we'll let Dr. Stacy tell us about the technology. And then most of the people on the call are using X39 and maybe Eon. There's a few that are using some other patches. So we'll let her walk through some of the other patches that are available from LifeWave, some of the things that, there may be normal things that people would experience, and just get a sense that, yeah, there's a lot more out there than just X39, but that is the mother of all patches, if you will, and that's the one that you would always wear. The others build on its success.
Mm-hmm.
And then we'll have an opportunity for a Q&A, and if you want to chime in and we have time, you're welcome to relay to the group some of the successes that you've had wearing the patches, because we've had some amazing ones just on those on the call so far. So go ahead, Dr. Stacy. Appreciate your time and your energy and leadership.
Absolutely. Well, thank you guys for having me on here. I appreciate it. I'm looking forward to connecting on a regular basis with you guys and being able to help you achieve success and help others do the same. So I'll give you the basic science and technology. And for those of you that just joined us, this is recorded. We're just getting started, so we can definitely share that recording with you if you have other people that want to hear this as well too. If you have questions, you can go ahead and type them in the chat. I'll be addressing them here in just a minute. I'm only going to spend a few minutes on science and technology and give you guys just the basics of what people ask, answer those basic, simple questions, and then be able to answer what questions you have specifically about the patches and how things could possibly work for you to help you have a better quality of life. So the technology that you guys are familiar with is the stem cell activation patch. The X39 that Mark mentioned is our flagship product. This is the mother of ship of all things right here for sure. And so this technology is a non-transdermal patch. And what that means is non-transdermal, nothing is transferring into the body. And so you're very familiar with birth control patches or nicotine patches or pain patches or estrogen patches. And those are things that are transferring something, a chemical or a substance, into the body. And so this does not work that way. This technology works with your body's light or a heat that we emit. And you know that if you go outside at night, you can see someone across the yard or across the street at nighttime only if you're looking through night vision goggles, right? So you can't typically see a person or an animal off in the distance unless you're through the night vision goggles. You can see the light being emitted, the heat being emitted from the body in colors. And so that's what we're working with here, okay, in this technology. And so when you apply this patch to your body's light or heat reflects back a signal from a crystal lattice structure that's embedded in this patch. And so a lot of people want to know, well, what is that structure? You said nothing's going into my body, so what is it? And so basically, not to get too technical with you guys, but it is a crystal lattice structure. And that is made up of organic amino acids, sugars, water, oxygen. And so that proprietary blend makes a crystal lattice structure. It's stereoisomers, and not a crystal lattice like a clear quartz crystal or an amethyst or tourmaline, anything like that. These are stereoisomers. So basically what that means is light communicating with light. It's a biophotonic exchange of information. Our light communicating with the lattice structure, the light that's in this patch. And so when you apply this patch, this stem cell activation patch, you either put it on the back of your neck, feel back there, that bumpy vertebrae, or you put it below your belly button in the morning when you get up. You're going to leave it on 12 hours. During that time, it's going to activate, elevate, and mobilize your stem cells. Remember, nothing's coming into the body. And so you have stem cells. You were born with an abundance of them, right? That's why 5-year-olds don't have gray hair and 10-year-olds don't have back pain and 15-year-olds don't have heart disease, because your body's constantly repairing and rejuvenating itself with the stem cells, right? And so what happens as we age, we make less and less stem cells. By the time you guys are in your 30s, which I think we're all past that from what I can tell from the pictures, you're making about half the stem cells that you did when you were a child. By the time you're in your 60s, you're making less than 10%. And that's just part of aging. That's just the way it is. Our body makes less and less of those cells that go to work to repair, regenerate, and rejuvenate, which is why you see the aging process. And so what happens is when you apply this technology every day, day after day, week after week, month after month, we can see from clinical studies done with people. We've done over 90 clinical studies, double-blind, placebo, independent labs, and doctors and researchers across the globe. You can see the increase of your body's own stem cells. It actually resets, this technology resets a third of your genome every time you put this on. And what that means is it is making your cells young and youthful. It is making them just like they were when you were 25 years old. Okay, upregulating or resetting those genes to a young, youthful state, which means those stem cells that are mobilized now, they're circulating throughout your bloodstream. Those stem cells are going to work to repair, regenerate, rejuvenate all your cells and tissues and organs in whatever order your body needs. The beautiful thing about this is we don't have to worry about picking. You know, if you're familiar with stem cell injections, which I've spent over 10 years doing that with my daughter, and other types of stem cell therapy, you have to go, well, where do I want these to go? Do I want them to go to the knee, the back, the shoulder, the wrist? Where am I trying to put the stem cells to regenerate that area? Well, the beautiful thing about this is your body knows how to heal itself, right? It has its own innate ability. You guys know when you cut your finger or you break your bone, it's not the Band-Aid or the cast that heals your body, it's your body, right? It's your stem cells that go to work to repair that area. And so that healing process slows down as we age. And so we're asking our body to do what it did when it was younger. And that goes for every single part of your body. Every cell, every tissue, every single organ is impacted in a positive way from this technology. And that is our main patch, the stem cell activation patch. When I talk about the other patches that work in conjunction with it, they each work independently on their own, and they also work synergistically. This technology, this stem cell activation patch, is our foundation. This is what we start with. It's just been out the last 3 years. There's literally nothing on the planet that does this, which is why we have a 20-year patent on it. But there's nothing on the planet that signals your body to increase its own stem cells. They don't even have anything medically, right? You have to go out of the country to get donor cells. And so it's definitely something that's 20 plus years ahead of the game. But just so you know, there are no side effects with this. There are no contraindications to any medications that you're taking. So you're going to ask me, well, what about if I'm on this medicine? What if I'm on this medicine for heart disease or high blood pressure or cholesterol or diabetes or depression? It does not matter. Whatever medicine you're on is perfectly fine. I would love to see you get off of your medicines if possible, but of course you'll have that conversation with your physician. But know that there are no interactions because nothing is coming into the body. So you have nothing to interact with. This is a pathway, a signal that your body already has. And so it's asking it to do what it did when it was younger, to remember that and to do it again. Super simple, okay? And so again, no contraindications, no side effects, nothing to worry about. If you're taking supplements, fantastic. If you're doing other therapies or modalities, you're perfectly fine. The only thing is if you have an organ from a person in your body that is not yours. So if you've had a heart transplant or a kidney transplant or a lung transplant, then you wouldn't want to use a stem cell activation patch. Okay. If you are receiving chemotherapy right now or radiation, then you would not use the patch on the days that you are taking the chemo or doing the radiation. You would do it on the days that you are not receiving chemo or radiation, because chemo and radiation kills everything. So there's no point in wasting your money in trying to increase your stem cell every day when you're taking chemo. So you would wait to the days that you don't. Now, as far as it goes with any other types of supplements, like I said, or medications, you're perfectly fine. I just have to make sure I tell you about a foreign organ or chemotherapy or radiation, because some people are taking those as well right now. As with anything, consult with your physician. If you have questions, I'm not your doctor. I do have a PhD in integrative medicine. I'm almost done with my PhD in functional medicine, but I do not work with medications. I work with holistic modalities. And so this is a tool that I found about 15 months ago to add to my toolbox. Like I said, after doing over 10 years of different types of stem cell therapy with my daughter. So that's the way the technology works. I do want to mention the Eon, because I know I heard Mark say that patch. This patch here reduces inflammation. It looks the same. As far as what it looks like, it looks just like this, but it signals a different peptide in the body, a different frequency in the body. And so know that when you use these patches together, synergistically, you're going to experience faster results. That's just the bottom line. I love what David says. David Schmidt is our inventor of this technology. He was actually working for the Navy SEALs, the U.S. Department of Defense 20 years ago. When he invented the first patch, he was given the information by God, downloaded by God, the information to create this energy enhancer 20 years ago. Okay. And so this technology has been out for 20 years. He's invented 12 different patches over the 20 years, obviously doing clinical studies along the way. But when I've heard him speak, and I know him personally, of course, when he talks about these two patches, I call this the dynamic duo. He says, if you inject, let's say you inject stem cells into your knee, we know that stem cells are going to go find the areas where there are inflammation. We all have inflammation in our body. Everybody does, whether it's from surgeries or illness or injuries or stress, diet, lifestyle, we all have inflammation. Stem cells go to the area of inflammation. If you inject 2 million stem cells in your body, let's say, for example, in your knee, the inflammation is going to consume the majority of them. You may end up with 200,000. That's it. So when we reduce inflammation, at the same time we increase stem cell production, you set the body up for a more rapid, dramatic healing experience, because the inflammation is not consuming your body's stem cells that are being made. And this reduces inflammation in many different inflammatory markers. And one of them I have to mention, and I'm just going to mention this because of the #1 killer in this world is heart disease. And we know for a fact from clinical studies, and not clinical studies done with this technology, but with clinical studies, that heart disease has a direct correlation to an increase in fibrinogen in your body. Fibrinogen is a blood clotting factor. Most people have thick, sticky blood. And their fibrinogen, if you were to look at it under a microscope, is clumped together, thick, okay? And so when you reduce inflammation, one of those inflammatory markers is fibrinogen. And yes, you need fibrinogen. It works with platelets to clot your blood so you don't have bruising. So it brings your fibrinogen level into balance. It is more indicative of heart disease, coronary heart disease, and heart attacks than cholesterol. Cholesterol is what they can sell a medication for, right? They can write you a prescription and sell and put you on Lipitor for the rest of your life. But they can't put you on anything to reduce your fibrinogen. It doesn't work that way. And so using this patch will help your heart, because it will reduce the amount of stickiness in your blood, keep your fibrinogen in balance. All of this technology is about balance. I mean, it has other inflammatory markers that it helps get into balance as well too. But I have to mention that because you only have one heart. And we know that most people have some issues with heart disease, right? At different levels and varying degrees. So we want to keep our heart nice and healthy. So using these two together will help get your body into balance in a much more effective and faster way than if you used it individually. And I know this from obviously what David has shared, but I also know this from 15 months of using this with my clients and thousands, literally thousands and thousands of people. And then I also know other people that have been using this technology without this. And every time I see them, they say, I wish I would have known about this because I probably would have got rid of a lot of my problems faster. And I say, yeah, it's exactly right. And that's the beautiful thing of using different patches together. They all work, like I said, individually, but they also work synergistically to help bring your body into homeostasis. So I know I've shared quite a bit of information with you guys, but I do want to make sure I get your questions answered. So if you want to type them in the chat, or if you want to unmute yourself, then feel free to do that now, and I'll answer any questions you guys have. Any questions?
That's a pretty quiet group. Let me take one. We know that you can't say that this really cures anything or heals anything, because it's really your body that's doing that.
Correct.
So having said that, there's I know that we've a lot of people on the call have seen a book that we've purchased. We call it the recipe book. And we have used those for a variety of different things, and they're very, very individual. I mentioned at our convention this last week a friend that I have that has tinnitus, and it was kind of like hoping for, wow, can I pray that I'm one of those guys that's a one-day wonder, but usually it's a longer period of time. But I know that there's at least one person on the call, in addition to a few off the call, that do suffer from that. Other than the protocol that's listed in that recipe book, which is a combination of multiple patches, is there any result from people just wearing X39 or just Eon and X39 over the course of more the long haul that would affect that?
There are some people that have said, obviously they have a smaller amount of tinnitus in their ears, that they got relief just from the X39 behind the ear, or just from the Eon with it behind the ear at the same time. Not very many. So it's definitely something that we have seen. Again, it takes a little bit longer, but there have been a couple people that I know that have just used X39 and Eon behind the ears and got results. But I found a protocol this weekend, because I have someone that I had mentioned, I think, to you, I'm not for sure, talk about so many different people and protocols, but we had someone that has been using it for quite some time now, months, and he's had huge success in one ear completely gone, and the other one's almost all the way gone. And so he's like, fine, tell me if you have anything else, any other protocol. So I did find another protocol, and it's using these patches, but using them over a 24-hour period. So I said, well, we've never used patches for 24 hours. He's like, I'm willing to give it a try to try to get rid of what's little bit that's left. And he's been using the technology not for tinnitus, but total maybe almost a year now. It'll be a year, actually it'll be a year in October that he's been using it. So 10 months. So he's a completely different person. Everything has completely changed about him. He's in his early 70s, but he just has a teeny bit left in that one area. He's like, I just want it all gone completely. So he's going to get those patches in this week and to double up on them over a 24-hour period, but we'll see. Good question. What other questions do you guys have?
Hi, Dr. Stacy. This is Sarah. I know we have somebody on the call who has a young son in his 20s who had a traumatic back injury and suffers from some chronic pain. Would you suggest anything other than the X39 and the Eon? And would you put the Eon on the point tenderness on the back, or what would you suggest?
Yeah, I would definitely use the X39 and Eon, use them on that location, like one under the other. But I would also use the LifeWave. LifeWave gets rid of pain immediately. And so X39 and Eon are not designed to get rid of pain immediately. Sometimes it happens that they do within a matter of 1 to 5 or 7 days, just because of the increase of GHKCU and reducing inflammation. Sometimes it does help with pain reduction, but that's not what they're designed to do immediately. LifeWave gets rid of pain on the spot. So use the X39, the Eon on that low back area, if that's where it is, one below the other. LifeWave, the way that technology works, you have to follow instructions or you're not going to get results. So it's really important that they understand that there is a white patch and a tan patch, and they have to work together, and they work with the polarity of your body. So if you have a midline, which you do, center of your body, then the white patch is going to go on the right side of his lower back. The tan patch is going to go on the left side of his lower back, wherever the pain is. If you have knee pain and say it's your right knee, then you're going to put the white one on your right knee and the left one, the tan one on your left knee. You have a midline, keep them separate. It's the easiest way to do it. X39 Eon LifeWave is going to get rid of your pain. This will not fix your problem. This just opens up energy channels to get rid of pain immediately. And pain is just stuck energy. And so if you can find that right channel by putting it on the pain spot, or maybe sometimes moving it around a little bit close to it, then you'll be able to eliminate your pain. That's your pain protocol. If it's a more severe case of pain, if it's something that's chronic and it's all over and I can't pinpoint a spot, then you can use Nirvana, the system. Nirvana system increases beta endorphins. It's 20 to 30 times more powerful than morphine. It's your body's own natural painkillers. It takes about 1 to 3 weeks based on clinical studies for that to fully kick in. Most people saw full pain relief in their entire body in 1 week. You know, of course, there were some, 2 weeks and like 1 or 2 people that were 3 weeks. But most people in a week, they're going to have full body pain elimination. But if you just have a spot, then just do the X39 Eon and the LifeWave. And as far as if there's damage to his back, if he was in an accident, you can also use carnosine. Carnosine is fantastic for tissue repair. And so, like, for example, my son, when he, sprained his ankle, I immediately put X39 Eon and carnosine all over his ankle for 7 days. And he was back on the court 7 days later. He was supposed to be on crutches for 2 weeks. So those will expedite that process.
One of our people had a question about, can the patches stimulate too much copper in the body or bloodstream?
No.
Okay.
No, it's not copper as in copper. It's GHKCU, which is a copper peptide. You want copper. You want copper in your body. You want to eat a diet that has foods that have all the trace minerals, right? We definitely want to do that. We want to have lots of vitamins and minerals and nutrients in our diet, but that's not going to increase your copper at all. It's totally different. You're welcome. Great questions. Somebody said, what patch would you use for fibromyalgia and how often do you use the patches? So you can do a couple different things. Number one, you use the patches daily, no matter what. They're used daily, day after day, week after week, month after month. Number two, you can pick what patches you want to use. We do have protocols, of course. You can use just X39 and Eon. But as you know, with fibromyalgia, that is a diagnosis of the decade. And so it's kind of like autism for kids, right? Let's just say you got autism. Let's say you have ADD, ADHD. 30 years ago when I was teaching, every child had ADD or ADHD. So what is the root cause of these things? Well, we've got inflammation in the body. We have a buildup of toxins in the body. Okay, so what do we need to do to support the systems? We definitely want to look at X39 Eon. We also want to look at glutathione. It's the master antioxidant, master detoxer, and immune booster. We want to get rid of those excess toxins that are built up in your brain and in your body, in your cells, in your organs. They're just, that compound effect is what's causing all of these chronic issues that people are dealing with, all the autoimmune. It's like an onion, it's like Lyme's disease, one thing on top of the next, 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 and it's all from toxins in our environment, in our food, in our water. And so we have to eliminate those. Using carnosine is huge as well too. Carnosine is a big antioxidant. And so having your body full of its own antioxidants, not putting exogenous sources in, but full of its own antioxidants helps your body to be healthy. We know the oldest people on the planet have the highest level of glutathione. That's a fact. You can research the blue zones. Those people are over 120 years old. They do tests on them. They measure them. They know what all their practices are. They also know what they eat. They don't eat what Americans eat, right? The modern American diet. Not all of us, of course, no judgment, but we do have the 7-day Advents out in the Lima Linda area in California. Yeah, Loma Linda. I never said that right. Loma Linda, California is a 7-day Advents. And so they are a blue zone, the only one in the United States. But those are the oldest people. And so we look at them and we look at what are their practices, what are their diet, what are their lifestyles. And we can say that, you know, they don't do what traditional Americans do, but I know you guys are healthy and you're making healthy choices, of course. So how do we support your systems? We reduce your inflammation. We detox your body from the toxins, and not a detox like you're in bed, right? You can use the glutathione every day. But we help your body to get back into balance with this technology, because again, nothing's going in. It's asking your body to do what it did when it was younger. And so that's why this is so beautiful, because it really works very effectively to help you achieve success.
You said that you could use the glutathione every day. I've heard a couple of different videos, and I know everybody's different, but let's just say a healthy person. I heard that you can alternate glutathione and carnosine on every other day.
Yeah.
So can you do glutathione and carnosine every day? Do you actually need to if you're really healthy? Just curious.
So for me personally, when I first decided to use this technology 15 months ago, I started using glutathione and carnosine every single day. I know what I've read and I've listened to videos, and sometimes they say you can rotate, like do glutathione one day, carnosine the next, glutathione, carnosine, because they do increase your level and sustain that level for a 24-hour period. But I just wanted to see, you know, what it would do, if it would do anything, or if I would feel anything. I didn't notice anything different. But I did go after a couple months and just started using it like every other day or whatever. And so when I had my biomarkers done at my 6-month point, she said, I think you should use glutathione daily. I don't see there's anything wrong with it. And I think it would be fantastic for your system, for your body, to make sure that it's detoxing, especially the things that are in our environment. And so I use it daily.
Okay. And the carnosine as well, or every other day? For the carnosine?
Carnosine, here's the thing with carnosine, it protects our telomeres. Okay. The telomeres determine the length of your life. It's great for muscle, building lean muscle mass, and for muscle and tissue repair. It is fantastic for the heart. It repairs your cardiovascular system. It is fantastic for your brain. It balances left brain, right brain hemisphere. It improves cognition and communication. I'm all for heart, brain, muscles. Sign me up.
Thank you. Awesome.
You're welcome.
There's another question in the chat, Stacy.
I don't see any other questions. No, it was just the fibromyalgia. But do you know a Sharon Wetch or a Victoria? I have a Zoom at 8:30, so I know some people may be showing up early. I've had a few of them that I've had to kick out, but I didn't know if those were your people or not.
Excuse me,
I'm
I would love
I'm not
to.
sure, but I'm okay not kicking them out. If they want to listen, that's fine.
The message was a direct message. Where does the Eon patch need to be placed, from Pamela?
Okay, that's a great question. And then I think Joe and his wife had a question too. So let me get my little booklet here and I'll share it with you, okay? So each patch comes with its own instruction guide, all right? And so it looks like this. Basically, Y age, there it is, this right here, okay? So whether you order the Eon or the glutathione or the carnosine, it comes like this. They all come in one little instruction card because they're the Y age series, which is all about reverse aging. Reverse age, obviously this was before our X39. You reduce your inflammation, you increase your glutathione, your carnosine, you're gonna live for a very long time. And then of course we came out with the X39. So for Eon, it shows you the different places you can place the patch. You pick your location. Typically people go back of neck or below the belly button, but you also can go inside of the ankle, the hand, or the foot. Whatever works best for you. You can pick any of these spots. But with Eon, you can stick it anywhere. If you have a joint that's large, right, that's bumpy from arthritis, you can wrap that finger with Eon to reduce the inflammation. You can wrap it with X39 to reduce the inflammation. It's totally up to you where you put the Eon, but it does have instructions in the booklet.
Thank you.
You're welcome.
Mr. Joe.
All right. Yeah, Joe and I are newcomers, and we'll be done with our X39 in 2 weeks. So Kathryn is ordering us the next bundle and getting us the Eon. However, there's half of the Eon with the new bundle. So she was suggesting wearing it every other day. So is that okay? Is that just as effective, or do we need to get the balance of the Eon to match with the X39 every day?
I would definitely use Eon every day. I'm okay if you're doing glutathione and carnosine every other day, but I feel like we have to address that inflammation on a daily basis. And that's what David recommends as well, too.
All right, so Kathryn, you'll take care of that for me. All right, I have another question. I have a daughter who has aqueductal stenosis since she's 16, and she's in her 50s. And she has a shunt, and she's had 9 surgeries on her head. And she gets a lot of headaches. But also now they've adjusted that shunt so many times that she has what they call tiny ventricles. So they can't do any more. So is there something that would help her?
Okay, so did you say she's 16 or she's 50?
She's in her 50s. She's had this, we discovered it when she was 16. They also discovered a very tiny little tumor at the base of her neck that has never grown. And we think that was the blockage that caused all of this. We didn't know that back then. This has just been discovered recently at Mayo Clinic.
Okay, so this is definitely technology that she can take to her doctor and they can take a look at it. But I mean, I'm not going to say she can or can't use it, just like I would with anybody. You have to make your own decision. And I don't want to say that it's definitely going to help her. We don't have clinical studies on that specific type of issue. We have clinical studies on the systems in the body. So when we look at the brain, we can see through clinical studies how it improves the brain and the coherence in the brain and what it does to be able to help the entire ventricle and vascular system in your body to be able to work more effectively. So if you think about it, just think of stem cells and what stem cells do. Stem cells repair, they regenerate, they restore, they rejuvenate all the cells and tissues and organs in your body with whatever your body needs. So stem cells are not going to go, they're yours. They're not going to go rogue and cause craziness to happen inside of your body. They're only going to help to repair. So if you think of along those lines, then where is my quality of life right now? What are the things that I'm experiencing that are lessening my quality of life? If I use this technology, it can only improve my quality of life, right? It's not going to harm you in any way. It's going to help improve that quality by basically bringing your body into balance, the systems, the organs, the cells, and the tissues with whatever order her body needs. You know, you may say, well, I really want to help with my brain or, you know, my heart. And yet we see clinical studies, we see improvements, but it may be more important to work with her liver or her spleen, right? But the body knows how to do that. And so those stem cells that her body's making from this technology will be able to go to work to repair whatever she is needing in that order. So it cannot hurt her, but of course, as with anyone, consult with your physician if you have questions. You can go to the website. I'll type it in here. It is startx39.com. And that website has all of our clinical studies. It has information from David on there in video form and written form. It has information from other doctors as well too, and how they utilize this in their practice. But you can also see the patents that we have. And so in order to do clinical study, you have to prove the effectiveness of what you're doing, right? You have to prove that it does what you say it's doing. And same thing with patents. You can't have a patent on something unless you have proven that it's done what you say it's doing. And so all of that information is on that website.
I appreciate that. So with this help, she gets excruciating headaches. I mean, she's an amazing girl. She continues to go. It never, stops her. But I mean, she has some really bad headaches. So would that help with the headaches, possibly? Or you don't know?
So using the X39, the Eon, and the LifeWave, that's our pain protocol. And so you would want to have all of those on board. I'm not going to say that X39 is going to get rid of her headaches, because again, it increases stem cells. If they go to work to help her headaches, that may be fantastic, but there's no guarantee that they're going to. And I know I may sound like, I can't tell you this is going to work. I can tell you it's going to work, but I can't give you that order. If you are in pain, you need LifeWave to go with that X39 and Eon, because that's what it's designed to do, is to eliminate the pain for you on the spot.
I appreciate that. Thank you so much.
Oh, you're welcome. Absolutely.
Hi, this is Sarah again, and I'll
Yes.
be fast because I know you have another one. I have a couple of questions that came into my phone on text. One is about sciatica, and having been using that myself for my sciatica, you can correct me if I'm wrong, but I have put the Eon actually on my point tenderness, and the X39 where it traditionally goes. And then I've used an LifeWave as well and found some relief. So that was one question I had, and you can correct me. And
Wait.
somebody wanted to go ahead.
Tell me what the question was again with that.
If it will help for sciatica, and if that is what one would do, is use the LifeWave with the X39 and Eon.
Yes.
Okay.
Okay. What
And
was
then
the second one?
Might one anticipate some neurologic improvement after a stroke?
Yeah, oh, absolutely. We've seen
Okay.
lots of that. And we have a Telegram channel. And so for any, whether it's headaches or sciatica or any type of health condition or issue, like I said, we don't have clinical studies on those, because then that would say that we're curing or treating something. We have clinical studies on systems and organs, right, and cells. But Kathryn and Mark can look in our Telegram channel, and they can search sciatica. They can search headaches, migraines, and different things like that, and be able to share with you those recorded testimonials of people sharing their personal experience with using this technology and how it's helped them to alleviate their symptoms from those things.
Thank you very much.
Mhm.
Yeah, and we have sent out several of those. So, this call was the first one for our team. So hopefully it piques your interest. But
Yeah.
quality of life is not something to just dismiss. And using a patch as opposed to paying thousands of dollars to your medical provider, who's probably just going to give you a pill and hook you for life on some drug, is this is too good to not pass around and relay your experience.
Perfect. What other questions do you guys have? You can type it in the chat, or you can unmute yourself.
Okay, I'll ask again.
Yeah,
I
go
think
ahead,
on
Sarah.
another call, I'm trying to absorb everything you say every time I talk to you. I think on another call, you said that, I believe it was the carnosine that helps with the pancreatic function.
Correct.
drink.
Blood sugar, pancreas, it's an organ. Yes, carnosine improves all the function of all the organs as well, too.
And I thought you gave some dramatic figure, like 80%, and I don't know. I don't remember. I don't have those notes.
You're thinking of the endocrine system. And so
Mhm.
that is the patch SP6. SP6
Okay.
also improves the functionality of the organs and the entire endocrine system. And so our clinical studies show that in 7 days, it improves the functionality of the entire endocrine system by 87%.
Okay, perfect. That's what I was trying to remember. Thanks.
You're welcome. What other questions do you guys have? You can either type them in the chat, or you can just unmute yourself to ask.
Well, I'll come up with one.
Okay, Joe, go for it.
Do you have any evidence about helping type 2 diabetes?
Yeah, absolutely. We don't have clinical studies, right? Because we can't talk about diabetes, because that's a disease that a drug is supposed to cure. But I can tell you about the function, just like Sarah just mentioned, of the pancreas. And so looking at your blood sugar, of course, we want to, definitely look at your nutrition, right? Because we know type 2 diabetes is I don't want to say easy to fix, but it's easy to fix when you look at the types of things you're consuming. And it may not be exactly what you think. I know a lot of times they're like, cut out all the sugar. And of course, we know sugar is more, addictive than heroin. So it's definitely not a good thing for you. But there's other things to look at as well, too. There's a great documentary that specifically covers diabetes. It's called What the Health, Health. So you can find that on Netflix. It's a fantastic one. But when you look at the pancreas and the organs, we would definitely use the X39. We would use the Eon, and we would use the carnosine as well, specifically looking at the pancreas and the blood sugar.
Well, okay, so I just had I had a doctor checkup a week or so ago. And so I do have type 2 diabetes. And so what he wants to do is for the next 6 months is try me with no medication at all, because I'm doing well. But I'm wondering, since we've almost completed our first 3 months now on X39, do you think that continuing on that, it will also help on lowering those numbers or keeping them low?
Just X39 by itself?
Yeah,
And well, now we're going to have the Eon also.
right.
So if you want to specifically improve the functionality of your pancreas and address the issue that you're talking about, you need the X39 Eon and carnosine.
Okay.
Okay. I do not know that your body is going to work to repair your pancreas by increasing your stem cells, right, in the next 3 months. I have no idea, right? There may be many other things that it's working on, but that's why we use different patches, because we can directly affect the different organs and cells and systems in the body using those patches on very specific points, acupuncture points that are in the instructions, because the clinical studies show that that's what it's going to do. It's going to affect those organs or those systems in the body. So if you would like to utilize those 3, then I can say, absolutely. I had a woman I Zoomed with last week. Her son is type 1. He's a young kid, type 1 diabetes. And using those 3 patches, his blood sugar was incredible.
Wow.
Type 1.
Yeah, his
But
numbers have gone down, so we're thrilled about it. His numbers have
That's
really come
fantastic.
down.
Yeah, that's good. And I would do anything you can to try to prevent using medications, because that's a slippery slope. 1 turns into 5, turns into 10 really quickly. Right? And so being able to do things holistically to be able to help support your body and help get your body back into balance. And we'll throw in a little age reversal in the process, right? By increasing your stem cells. We can show in studies that every 6 months using this technology reverses your cellular age by 8 years.
Wow.
So you give it 12 months and you're going to be 16 years younger, or you're going to be 12 months older. It's up to you.
16 years younger is good.
Yeah.
Yeah.
There's a question in the chat, Stacy.
Yes,
Is
a
there
guideline
a
for
guide?
children. Yeah, so obviously we've not done clinical studies on kids, right? That's just totally not allowed. It's like pregnant or nursing women. Do I have thousands and thousands of moms using this technology on their children? Absolutely. My children are the first 2 people I put patches on. So it's totally up to you. It's kind of like going through McDonald's drive-through. It's a total choice, right, that you make. One can be very beneficial and one can be very detrimental. And so it has to be your choice on what you do for your child. Of course, I would never recommend that you go put these patches on your kids, but yet you can go in the Telegram channel and find tons of moms talking about using this technology as young as 2 years old. I mean, one of the first moms that bought the patches from me, her son was 4 years old last year, autistic, nonverbal, non-communicative, not interactive, would not even look at you. Now the kid's in kindergarten perfectly fine 15 months later. I don't know, but something changed. And the only thing that changed was this technology, and it changed rapidly for him. He was only 4 years old, but he started talking, he started interacting, having conversations, playing, pretend play, doing all the things a typical 4-year-old should be doing with his brother and with his parents and his grandparents from using this technology. So like I said, I definitely can't say yes because we don't have clinical studies, but we know that patches improve the functionality of the body, and we know the body gets out
Stacey,
of balance. So.
What did they use for the autism, please? What
So
patches?
X39, Eon, and carnosine. Carnosine's huge for the brain, remember?
Okay.
It balances the left brain, right brain hemispheres, improves cognition and communication. Whether you're 2 or you're 102, the brain is, you only have one brain, kind of like one heart, right? And so it's definitely going to help. Of course, we have people that, you have your typical Alzheimer's, dementia, that people talk about. Again, that's cognition, that's memory, that's focus. So we know that the X39 improves that. We know the Eon improves that. We know the carnosine improves that. So yeah, Nirvana on your 12-year-old granddaughter, and she uses X39. That's fantastic. Nirvana is our bliss patch that works with the neurotransmitters and neurohormones in the brain to help with anxiety, stress, depression, worry, fear. Like I said earlier, it's increases beta endorphins. So it is a natural pain reliever because that's your body's pain reliever system, but it works fantastically for the emotional components that kids as well as adults deal with. So, and we know.
I have a question. Oops, I'm sorry. I have a question.
Yes.
This is Rosemary, and you have been talking a lot about using the 39 Eon and carnosine together, which would mean in my mind, of course, all during the day. And I've been using Eon. I use all 3 patches, and my husband uses all 3 patches, but we have been using Eon at night because I think something David said that's what he did. So,
yeah, you can use Eon or carnosine day or night. It's totally up to you. A lot of times with people, it's the monkey mind. I can't calm down. I can't relax. I can't chill out. I can't go to sleep. And so Eon is not a sleep patch. That's called Silent Nights. But we know that Eon helps put your body in a parasympathetic state. So it reduces inflammation. It helps put your body in a calm, relaxed state. And so if you're someone that just can't shut it off, then you can definitely use the Eon below the belly button. It's called a triple warmer spot. You can put the Eon below the belly button at night to help you with your rest and digest system, right? Your body's supposed to be restful. Really, you're supposed to be in a parasympathetic state all the time. You're not supposed to run around in that fight or flight mode, go, 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 stressed out all the time. That is a huge indication for disease in the body, right? When you're constantly stressed. And so using Eon for anybody and everybody to help keep your body in that happy place, right? We call it our happy patch. We call Nirvana our bliss patch and Eon our happy patch. But yes, Rosemary, you can definitely use Eon or carnosine day or night. It's totally up to you. Not one's going to work better than the other. It's whatever you personally decide, but know that you definitely want to use X39 only during the day.
Okay, so just to be clear, the 3 patches work together and they do not have to be together during the day. They can be
Correct.
split.
Correct.
Right? Okay.
Yeah.
Thank you very much.
You are welcome very much. Any
We're
other
gonna-
questions?
We're going to go ahead and, we're going to go ahead and wrap this up. I live on Zoom in my corporate life, and I understand that when you do Zooms back to back, it's nice to have a personal moment between the calls. And I know that Stacy, Dr. Stacy, does these on the hour and a half hour. So we will do this again next Tuesday, and we'll try to make it on a regular Tuesday. We want to double the attendance next Tuesday, and if you want to volunteer to be talk about your experience, send that to me as well, and we'll have a couple people from our team relay what they've experienced. So thank you to Dr. Stacy. Thanks for your support, answering all the Q&A, and we will see you next week.
One more quick question, but there's just eczema. I mean, I'm
Yeah,
assuming
I was
with
gonna say
eczema.
2 things. Eczema would be X39 and Alavita for sure, and Eon and glutathione. You want to detox the body. So something's happening with the body from the skin's our largest organ. So Alavita works for the skin, does a lot of things too, but it's fantastic for the skin. So I would do that combo. And then also there are a lot of people that came here in the wrong time for my Zoom that's happening at 8:30, which is in 7 minutes. So for those of you that joined here in the last 20-25 minutes, you popped in and I went ahead and let you because Mark said, yeah, let him in, that's fine. But this is Mark and Kathryn's Zoom, their team Zoom that we did 7:30 to 8:30 was their time. And so if you are wanting to hear the science and technology from the beginning and get your questions asked, I'm going to end this Zoom because I am recording this and I want to give this recording to them. And I will start again at 8:30, which is in 7 minutes. So, but thank you, Kathryn, and thank you, Mark, and all of you that joined from their team. I look forward to hearing from you guys again next Tuesday, all your questions, and I'd love to hear more of your testimonials as well, too.